Hi, my name is Diantra Siciliano and I'm here to present about the OXYHEMOGLOBIN dissociation curve and the ventilation and perfusion of the respiratory system. So first, let's dive into the OXYHEMOGLOBIN dissociation curve. So this curve describes the relationship between the partial pressure of oxygen and the oxygen saturation. Now, in this curve, there are two main players, which I'm very sorry about this mistake. So PaO2 measures the dissolved oxygen, and the SaO2 measures the oxygen bound to the hemoglobin. So the PaO2 and the SaO2 are different when it comes to technical terms, but they are in fact related. They are in equilibrium. They are in what we call a sigmoidal relationship, and that sigmoidal relationship is the S curve that we see right here. This S curve, this is sigmoidal. Okay, now this curve, the oxyhemoglobin dissociation curve, shows how much the hemoglobin is associated or bound by oxygen and how much is dissociated at any given PaO2. So, in this curve, we see this is the PaO2 and this is the SaO2. So, the PaO2 mercury of 60 milliliters is equal to an SaO2 of 90. It's also the same with PaO2 mercury of 40 milliliters is equal to 75% saturation. So they are not intact. This one is not intact. This one they're always not intact because uh, the curve might shift under different conditions. So, the result of the sigmoidal relationship is that when you have a 60 milliliter uh, PaO2 of mercury and you wanted to increase the total blood oxygen content, increasing the PaO2 would do very little because all the hemoglobin are all bound and saturated. And we all know uh, the hemoglobins are where the oxygen is found. So at 60 milliliters of mercury, there's only a small percent of oxygen binding sites left. So increasing the concentration of hemoglobin, like maybe having a blood transfusion, will be much more effective by uh, proving more sites to which the oxygen. I mean, by providing more sites to which the oxygen can bind. A sigmoidal relationship also can result in relative hypoxemia. It can develop while the SA2, this one, remains within normal limits. So, for example, a patient that has pneumonia can have a PO2 of 100 that will go down to 60, while the drop of the SA2 remains at 90%. Okay, now this is all my understanding. This is all of what I can understand of the oxyhemoglobin dissociation curve. So if it's a little bit um as it's a little bit unclear, I'm very sorry about that. But what this is my complete understanding of the oxyhemoglobin dissociation curve. Now we're moving on to the ventilation perfusion of the respiratory system. So, during respiration, our lungs work to help our body take in oxygen while breathing out the carbon dioxide. So, this process is what we call the gas exchange. So, the amount of ventilation and perfusion must be equal in the alveoli of the lungs. So, ventilation, or abbreviated as V, is the amount of air that enters and leaves the alveoli, and perfusion, or abbreviated as Q, is the amount of blood that flows to the alveolar capillaries. So together we have the VQ ratio. So the VQ ratio is the amount of air that reaches to the alveoli per minute compared to the amount of blood that reaches the alveoli per minute. All right. So going back here to the gas exchange, for this to process uh, correctly or properly, there must be a balance to the ventilation perfusion ratio, or the VQ ratio. So that means that the ventilation here must match the amount of perfusion in the alveoli of our lungs. Okay, so ideally, the amount of oxygen in blood reaching the alveoli would be a perfect match, but sadly that's not always the case. We don't always get a VQ ratio of 1. Some patients with cardiopulmonary conditions have a what we call a ventilation perfusion uh, imbalance. So that is my full understanding of the ventilation perfusion. Here are my references, and thank you so much for listening.